When CBO released its score last week and pegged the cost at less than $900 billion, the headlines suggested that this is all good news. Well, the folks back home were asking me, well, what does it really mean? What does it mean to be deficit neutral? But more importantly, what does it mean to me and my family? What is this going to do? What is this health care bill going to do to my insurance that I have? And when I can't come back to them and tell them with any degree of certainty that, no, this is not going to increase your premiums, they will want to know, well, how much and why? And then, as my colleagues have mentioned here, the suggestion that it will increase your taxes. Well, tell me how much and why. And if the president has said we're not going to be increasing taxes on the middle class, on those of lesser means, then how can this be that, in fact, my taxes will be increased? When we talk about the Medicare cuts, in my state of Alaska, we've already got a Medicare crisis when it comes to access to a provider. We simply don't have providers that will take Medicare-eligible individuals. So now I have seniors and those that are disabled calling me and saying, well, what does this mean? Does this mean that it's going to be even longer? It's going to be even more difficult for me to find a provider who will take me if I am Medicare eligible? But then you have those that say, well, okay, all these things are unknown and uncertain, and we expect you in Congress here to work it all out. But there are some good things that will be coming that we're counting on, and I'm looking forward to that day when my insurance carrier won't be able to deny me because of pre-existing conditions. But then when you remind them that, in fact, certain of these provisions don't even take place, don't even become implemented until 2013, 2014, it's like, well, wait a minute. So you're going to increase my taxes, you're going to make cuts to Medicare, you are going to increase my premiums, and I'm not going to see the real benefits. How can this be called health care reform? This is what we've got to resolve.